Good evening and welcome to the 2017 presidential debate. I'm your host, Tom Dickerson. Today we have a case study that is important to discuss, and we have our two presidential candidates, Donald Trump and Hillary Clinton, to fight it out and tell us their goals and interventions. For our viewers at home, here's a little information for you regarding this case study. Our client is a 43-year-old African-American male, non-smoker. He is 6 feet tall and weighs 210 pounds. His BMI is 28.5. His vitals are 120/82, which means he is pre-hypertensive. Pulse rate is 63 beats per minute, and respirations are 14 rests per minute. He currently is taking Toradol, acetaminophen, clozapine, and aspirin. He has no known allergies and has been diagnosed with osteoarthritis. He is a retired officer in the armed forces and is currently enrolled in college training for a new career. He suffers from osteoarthritis and schizophrenia. Since being in a car accident 3 years ago, he has undergone implant placement. He is unaware if his toothpaste contains fluoride and states that he wants to maintain his oral health since he was discharged from the military. Client reports not having success with floss threaders, and he uses wax dental floss several times a week and uses toothpicks after meals. Now please help me welcome to the podium our Republican candidate, Donald Trump, to discuss some of the objective data he's collected.
Thank you, Tom. Good evening, America. It's incredible to be here. I'm excited to tell you how we as a country can make our case study great again. But here are some of the findings that I found. I found subgingival calculus and huge number of missing teeth right here. Thank you.
Thanks, Donald. Now please help me welcome to the podium our Democrat candidate, Hillary Clinton, to discuss some of the objective data she's collected.
Thank you, Tom. Thank you, America. It is an honor to be here. I was going through all of my emails and noticed that my case study somehow got deleted. But what I did find was a lot of restorations and an implant. This guy's looking a little deplorable.
Okay, so let's get into why we are here tonight. Our first deficit is protection from health risks related to potential risk of a medical emergency and increased risk of infection. Evidenced by blood pressure reading 120/82, BMI 28.5, and medication. Donald, tell us what goals and interventions you have.
Well, by the 6-month re-care visit, our client will decrease blood pressure readings from 120/82 to 118/80. And you want to know something? I'm going to explain to you. This client needs to know that blood pressure is the amount of pressure blood exerts on the arterioles. It's also important he lowers the diastolic pressure to reduce risk of cardiovascular disease. You want to know what else? High blood pressure increases the risk for a potential medical emergency associated with angina, MI, and stroke. And I actually read all that in the American Heart Association website. He clearly needs to eat some heart-healthy foods such as omega-3 found in fish, fiber found in fruits and vegetables, and the benefit of lean meats to reduce elevated blood pressure readings. And you know what? He has huge changes to make.
Donald thinks his blood pressure is important. I think his BMI is important. It's 28.5. We want a normal BMI of 25. We need to educate this client on reducing his BMI. He needs to understand the correlation between the effects of weight gain and excessive eating habits that have to do with medication clozapine. He also needs to know how weight reduction can help relieve stress off his joints and spine, reducing the pain.
All right, now we have a deficit in freedom from head and neck pain related to risk of aggravating osteoarthritis and cervical spine injury. This is evidenced by medication for acute pain and diagnosis of osteoarthritis and client's statement of car accident 3 years ago and having steroid injections. Donald, what are your thoughts?
At his current visit, this client will state what seating position is comfortable. I'm going to tell him he needs to know the difference between supine and semi-supine position. It's such a simple choice. You either lay all the way back or sit up a little. And if he really wants to be comfortable, I'll throw in a pillow to put underneath his neck for stability.
Tom, at the current appointment, I think it's important for the client to report a 2 on a pain scale from 1 to 10. I'm going to discuss with him if he's uncomfortable at any time, he should raise his hand to terminate treatment. I'm also going to explain the importance of taking his Toradol to keep his pain at bay during treatment.
Thank you, Hillary. Now let's talk about another deficit we're dealing with here. It's conceptualization and understanding, and it's related to the knowledge deficit in our patient and the inability he has to perform sufficient self-care. Evidence is by the client's statement of unawareness of fluoride in his toothpaste, unsuccessful use of floss threaders in the anterior teeth, inappropriate use of toothpicks, and limited dexterity. Hillary, what are your concerns, and how will you help our client understand better?
That's an excellent question, Tom, and it's extremely important that by the end of the visit, our client will verbalize the benefits of daily fluoride use. I will discuss with the patient that fluoride aids in strengthening weakened enamel and protecting the tooth surface from further decay. And not only does fluoride strengthen enamel, but it also reduces areas of sensitivity due to enamel loss. I'll also send the patient home with a couple of samples of fluorinated toothpaste, such as Crest Pro Health or Colgate, something I don't think Donald would do.
Thank you, Hillary. And what are your concerns, Donald?
Well, Tom, America and Hillary needs to be able to demonstrate how to use floss threaders. I have flip charts to show the floss threader technique, and I'll explain to the client that it's indicated for use under his implants right here. This little wall, actually it's a bridge. He needs to get around those for better plaque control. I just need to show the client how to use the floss threader in the mirror and then have the client demonstrate back to me. I chose this article to discuss with my client how to care for implants to ensure their long-term success. Implants, they need constant maintenance and monitoring. From education to assessments, effective oral home care is key to success.
Another deficit to discuss to our viewers is responsibility of oral health related to the lack of regular home care. This is evidenced by the client's statement of flossing several times a week and a chief complaint of maintaining oral health care since leaving the military. Let's see what Hillary has to say.
Tom, by the 6-month recare, I need the client to increase his flossing habits from 3 times a week to 7 times a week. I will educate the client on the relationship between flossing regularly and gingival inflammation.
Well, by the end of the visit, the client will schedule a 6-month recare appointment. I'm going to discuss the importance of maintaining a regular cleaning schedule in order to control disease and prevent further progression of bone loss. I'll hope to see the patient every 6 months and motivate patient to agree to this schedule.
Now it's time to narrow down to our last deficits. To discuss during our power round, where each candidate will discuss one goal and intervention for this deficit. Backstage, we had both candidates play a little harmless game of rock, paper, scissors to see whose deficit would go first. Let's take a look at who won.
Rock, paper, scissors, shoot.
All right, looks like Hillary won. Let's have her discuss her views on skin and mucous membrane integrity of the head and neck.
America, as you know, this deficit is related to plaque accumulation, periodontal disease, side effects of clozapine, and inadequate oral health behaviors. They are evidenced by the probe depths, moderate bleeding upon probing, GI, PI, and light subgingival calculus, also xerostomia. The one goal I chose to discuss is a 6-week recare after placing Arrestin. Clients will have no increased probe depths. I'll use my flip chart to explain periodontal disease. Using Arrestin in these pocket depths of 5 millimeters and more and reevaluate in 6 weeks. I'm going to review and encourage self-care aids and instructions previously discussed. America, I chose this article because it's about periodontal disease. This gentleman has localized periodontal disease, and to keep it from progressing further, this article is going to educate him in how to do that.
And for our last deficit, we have Donald Trump discussing his views on biologically sound and functional dentition.
Well, America, this is it. The last chance to make America great again. And I know you'll vote for me because this deficit is related to fermentable carbohydrates, trauma, extensive restoration work, and malocclusion. The evidence is vicarious lesions, mesial-occlusal number 20, missing teeth, clinically visible implants, attrition, and edge-to-edge anterior bite and posterior open bite. My one goal I have chosen to discuss is this client will consider discussing orthodontic treatment to fix his malocclusion. I will discuss benefits of orthodontic treatment and how this client will be able to chew better and not wear away his teeth from his malalignment. I will personally give this client a referral for orthodontic treatment. Just check out his bite.
Well, folks, that's all for this evening. At this time, I'd like to let you all know that his appointment plan was finally narrowed down to 3 30-minute appointments to accommodate his health and to reduce any discomfort of his joints. During his first appointment, we discussed his medical history, oral cancer screening, doctor's exams, we collected indices, GI and PI, oral hygiene instructions, and gave referrals. At his second appointment, we divided all 4 quadrants, fine hand scaled, and then placed a Reston in those deep pockets. In 6 weeks, he will have his third appointment. We will check the progress of I would like to thank both of our candidates for coming out and discussing our deficits. We hope to see you all voting. Tonight's debate has been sponsored by clonazepam, Toradol, Asparcream, and acetaminophen.
Do you or someone you know suffer from hearing voices?
How's everything going, Marissa?
It's alright. I've been hearing a lot of strange noises lately, and then I started hearing voices, and they kept telling me to do stuff that I know I shouldn't be doing, and I just can't get them out of my head. So I actually just went to the doctor, and he prescribed me clozapine.
Oh, nice. You feel better?
Yeah, I do actually.
Good. Glad to hear it.
Tell your doctor if you experience hypotension, tachycardia, constipation, vomiting, and heartburn. Serious side effects include agranulosis, Parkinsonian syndrome, and myocarditis. Do not take clozapine if you are currently taking clarithromycin, carbamazepine, ketoconazole, and sequinavir.
Jess, are you okay?
Yeah, I'm fine.
What's wrong?
I have a headache.
Oh, well, here, I have some acetaminophen for you.
Oh, thank you.
Acetaminophen to relieve pain and fevers. Forms come in tablets, caplets, gel cap, or oral solutions. Side effects include dizziness, disorientation, urticaria, thrombocytopenia, neutropenia, agranulocytosis, and hepatotoxicity. Contraindications and warnings: severe active liver disease. In alcoholics, risk of hepatotoxicity. Rare but serious skin reactions can be fatal.
Are you or someone you know suffers from osteoarthritis? You should consider using Asparcream, most effective on the joints closest to the skin. Apply liberal amounts topically to the affected area and massage 3 to 4 times a day. Some things to be cautious about is hypersensitivity. You want to avoid the eyes and avoid applying over a large surface area.
Is a non-steroidal anti-inflammatory medication that alleviates inflammation and pain. It's a short-term treatment for adults dealing with moderate and severe pain. This can be in a tablet form or an injectable form.
Toradol reduces the levels of hormones in the body that cause inflammation and pain, but some of the common side effects include diarrhea, drowsiness, nausea, vomiting, indigestion, stomach upset, and bruising at the injection site. Some of the less common but serious side effects include blurred vision, fever, high blood pressure, skin rash, confusion, swelling of the legs, symptoms of liver problems, and clotting complications.
It's indicated to use under contact.
Go.
Tom, this deficit is related to plaque accumulation, periodontal disease, side effects
Sorry,
of
I think you're accumulation. That was a good accent.